Yes, we
Thank
can.
you so much. So I'm delivering our presentation today on behalf of a much larger team. So thank you so much for having us. This is very much an international collaboration. So I'm based in Cape Town in South Africa, and Megan Laws is in the UK, in London, and then Megan Beasley, who's part of the audience at the moment, is the director of the Kalahari Peoples Fund in the US, in Austin, Texas. But our team comprises of a large number of people from many different countries around the world, with a shared common goal of creating information, or specifically healthcare communication, in endangered languages of Southern Africa. So I'd love to walk you through our crash course in emergency communications in a Southern African context. So despite extensive research in the field of linguistics, and especially around the topic of sustaining linguistic diversity, relatively little is known about Africa's endangered languages. I think there's often this misconception that Africa, being the cradle of mankind, that we've got this massive diversity of languages and multilingualism, and therefore we don't have endangered languages in Africa. But that's certainly not the case. So the area which we're focusing on in particular are these three countries, so South Africa, Namibia, and Botswana. And the reason why we focus on those is primarily because that's where we have the most experience in terms of who our team members consist of, and also that we have long-standing relationships with various community members in those three countries who would be able to collaborate with us digitally in order to create any kind of outputs that could be meaningful in such a context. So already for us to stretch ourselves over three countries was really a huge stretch. So the target languages that we focused on, because there were multiple, and there are multiple endangered languages in Southern Africa. These were minority languages that we had experience with because of this kind of emergency response that we were doing. We didn't feel it was within our comfort zone to take on additional languages that we didn't have a working relationship with, especially considering the sensitive nature of the content to do with COVID-19. Our primary focus was on Khoisan languages. You also see it sometimes spelt with an I, so with an E is an English spelling and with an I is a German spelling, but the German spelling's often been adopted in English texts as well. And so that's previously considered one language family, and that's been debunked. And we actually know now that there are actually three separate, unique, and not mutually intelligible language families. So Khoisan languages is no longer considered one language family, but three separate families known as Khoita, Ka, and Khoekhoegowab. So these are the languages from these language families. So we made a selection thereof that we focused on. So Xhosa, for example, spoken in both Namibia and Botswana. Omaheke Ju, so a particular dialectal variety found in Omaheke in Namibia. Khoekhoegowab, which is spoken in Namibia and South Africa. Khwedam, again in Namibia and South Africa. Naro, which is spoken in Botswana. And Kung, which is in Namibia and South Africa. We then also focused on other languages that are also endangered but are not Khoisan or Khoita or Khoekhoegowab languages. So for example, languages that would be dominant lingua francas, especially when it comes to languages of literacy. So we had a very multilingual approach where if we are creating oral outputs or audiovisual, then we go straight for the mother tongue. If, however, there are text varieties as well, we need to be very cognizant of access to literacy and what languages of literacy there are in each area. And so we've had to also include some of the dominant local lingua francas. So OtjiHerero was one of those, as well as Himba. And we included Afrikaans, which is a dominant lingua franca in both Namibia and South Africa. So this map just shows you a dispersion of the three language families. So you see, for example, with all the red markings, I hope they're big enough on your screen to see them. The red ones are all the Khoekhoegowab or Khoi languages. So you see quite a dense concentration in Namibia, with these languages being the most vital. You see some in the Caprivi Strip, and you see then some smatterings in Botswana, and then a few over the border into South Africa as well. The next group, so the Khwedam group, you see the orange markings on the map. These go up into Angola, again into the Caprivi region, and then around the border again between Namibia and Botswana, and then a dense concentration in South Africa in a small town called Platfontein. Also, you see there, you notice a red star, which are Khwedam speakers who originally lived in the Caprivi Strip and then moved down to South Africa. Then the small blue marks, these are of the three language families the most endangered. And you see speakers in Botswana, Namibia, and then you see some tiny little blue marks in South Africa, and is highly endangered, almost moribund. We only have 2 known speakers remaining in South Africa from this particular language family. So it is a large geographical area that we're covering, as well as multiple languages that are not necessarily mutually intelligible, nor do they share the same orthographies. That's a very political thing. So you can have the same language used in 2 different countries, but not necessarily following the same user conventions. So from our perspective, the COVID-19 information in a mother tongue is a basic human right. And in Africa, or in Southern Africa in particular, we don't have access to any kinds of major government support for these kinds of initiatives, nor is there much funding available or language research institutes that specifically focus on this in terms of long-term support and focus. So the coordination was difficult, I'll put it like that. So I'm sure we're all aware that the COVID-19 pandemic caused social and economic distress worldwide, and this was definitely felt in Southern Africa. And speakers of minority languages are most definitely at risk of being excluded from this important healthcare information. And it's very scary as well when a lot of these speakers also live in rural areas where they don't have access to online facilities because there is no network coverage in those areas. Cell phone data in South Africa and Southern Africa in general is still very expensive and not really accessible. And then just access to smartphones or laptops, again, is very small percentage of the population. So just getting general information about the COVID-19 pandemic is not easy. So an attempt to solve this problem of exclusion, Kalahari Peoples Fund was definitely at the forefront of this and rallying people together, whether they were from an NGO, an academic background, or local volunteers on the ground, to put an effort together to make sure that local community members have the information that they need in order to protect themselves and have a better understanding of what's going on. It became quickly evident that a one-size-fits-all approach or solution was not going to work for our purposes, and we needed to be much more strategic in how we were going to tackle this problem. So some of our issues that we came forward is that we have speaker communities in different countries, as is illustrated in the map. So you've got people in South Africa and Namibia and Botswana all speaking the same endangered language, but under very, very different contexts for each in each country, or even different locations within the same country. So therefore, for each location, individual action plans need to be established to suit the needs of each affected community. So, for example, some communities lead sedentary lives with access to running water, electricity, permanent housing, internet connection, and even if this is only through a smartphone, whereas other communities lead a much more nomadic lifestyle, and they don't necessarily have access to running water, electricity, or network coverage, nor do they have a permanent dwelling. So nomadic lifestyles are still prevalent among speakers of these endangered languages. And these differences are not language specific, but rather that they are location specific. So therefore, one can encounter both of these scenarios for one language. So the variables begin to quickly mount, and our different action plans have to be incredibly flexible. Additionally, literacy in the mother tongue of minority languages is very much disrupted in Southern Africa. Often it's not supported in the formal language learning context. So we have the situation where we have speakers who are fluent in their mother tongue, but they are not necessarily literate in their mother tongue at all. They're often literate in an additional language. So we developed a multimodal model to try and kind of cover all our bases, to be sensitive to our economic constraints and logistical and so on. So we have these 18 paneled A2 booklets that we developed that are based on WHO content. So we translated these, and these were then adaptable and easily adaptable once we had developed the templates for them, that they could be used as a booklet or a laminated poster. So a laminated poster, for example, would be better suited to a rural area with a lack of access to running water. So the booklets wouldn't last very long with grubby hands. But if we have something laminated and it's put up in a central place, it tends to last longer. Also, we created animated videos that include audio of the mother tongue. And these animated videos are an animation based on the 18 panel booklets and laminated posters. So for those people who are not literate, they can then watch the animated videos, or the WAV file is also played over the radio. The radio was also integral in sharing the COVID material online among community members. So our main goals were to be communicatively effective in the mother tongue, and also to be prudent within a limited budget. So the resources needed to be easily adaptable into their different contexts without us wasting too much time reinventing the wheel for each output. So I want to just show you a very short clip so you have an idea of how one of these resources works. So this is a first panel you see there on the right hand side where it says coronavirus COVID-19 on top, and there you see the text. That particular text is written in Xhosa, and I will play a short excerpt for you so you can hear that the person can choose to either read or listen, or both, to the content. And this is how it would look either on their smartphone or on any device.
COVID-19 hek uya acho sikota angrisisi moresa triko atok ajusa trehe COVID-19 ko amoresa usa trekiam wasi kana ko COVID-19 Khwedam eya coronavirus ko uko Namibia Khwedam we the coronavirus re okwa the rusa corona.
So that's just a snippet of how one of the resources works. It includes contact numbers for local clinics, Ministry of Health, these kinds of things, so that community members can reach out and ask more questions if they have more questions, and they have the information that they need to do so. Here is a short clip of community members where you see there's one smartphone in one village but multiple users. Okay, so we had to take a multilingual and bilingual approach. So an example, sorry, of how this would work is a small town of Platfontein in South Africa. There are approximately 8,000 speakers of Khong. There are only 16,000 speakers of Khong in its entirety. So this is a real dense concentration of speakers. So in this context, there's a local radio station and community members have access to running water, electricity, and network coverage. So in this particular context, community members then elected for audio and video materials in Khong to be shared via social media and their local radio station. However, the laminated posters and the selected locations for, for example, outside local shops, booklets for distribution that were maybe needed at the local clinic and so on, where not so much for handling by multiple people, but for the nursing staff to give to patients for them to take home and read within the privacy of their own space, should they want to engage with the material on their own. So due to low literacy rates in the mother tongue, they requested that these materials be provided in Afrikaans as well for the written context. So our in-person collaborations were achieved digitally and locally. So for example, local preparation was we would develop these resources collaboratively online. These would then be sent and emailed to local printing shops as close to the location as possible to avoid any unnecessary transmission. And also the audio-visual materials would be shrunk and zipped and made as small as possible so that they wouldn't use much data on smartphones. Once visiting local villages, again, only local community members were used, no outsiders to be visiting the communities, and playing and discussing the audiovisual materials in each village and sitting and explaining and answering any questions that people might have after they had watched the material. They could also then share this content via WhatsApp if they did have network coverage. If they didn't, then the materials were shared via Bluetooth to as many devices as possible. We also put the posters up in multiple languages in key locations that community members had identified and suggested. Through our efforts, there were also some additional support that was provided by international donors who wanted to help our cause, and they were providing masks, soaps, food parcels, and also we were gathering information about local community needs at the time when any village visits were taking place, so that there was a feedback going between the community and those who were collaborating online. So here's just some basic photographs just so you can get an idea. So in Botswana, for example, we're working in Khwedam Sand Lodge with Naro speakers, and you can see they were opted for a bilingual English Naro take of the content. And in Namibia, the very far northern region, here we have some workshops where you can see a young man sitting on his haunches. He's watching some of the content and he's doing a demonstration on how to wash your hands, all in the mother tongue. And in the Omaheke region, there's a workshop with young mums, and then another workshop outside as well, explaining about all the different information that people would need about COVID-19. And you see that people are getting very creative. So with the lack of infrastructure or spaces, a tree is now a suitable place for putting up the poster in the village and for giving a lesson about COVID-19. In other instances, the tree maybe wasn't big enough, and so a car was used. And so here is teaching in Himba about COVID-19, and you see one of the elderly ladies starting to cover her face as she's receiving the information about COVID-19 and how she needs to look after herself as an elderly woman. In Platfontein in South Africa, we're doing similar things, teaching children to wash their hands, and distributing information and resources. In Uppington in South Africa, there were 2 language schools for endangered languages, and so we provided the content there for the teachers to use and disseminate in their classrooms. And in the Kalahari in South Africa, again, visiting the elderly who live on very remote farms, who are still speakers of the language, and having workshops where we had local community volunteers discussing the content with community members so that they were kept in the loop with regard to COVID-19. So you can access our materials for free. Here's the link to the website. I can also put it in the chat thereafter. All the templates are available for free, so should you want to use them to translate the content into a language that you work with, you're welcome to use our templates and our illustrations and so on. We very much want to share all of our content, so it's absolutely for free and online. And also, if you'd like to have further information about the project at large, you can visit kalaharipeoples.org, and there you can find out more and also donate should you feel you'd like to the kind of work that we're doing. We have run out of funds, and what we had hoped on doing was to continue with the work and translate materials about why one should wear a mask and how to look after your mask, and not share it with others, and to wash it and so on according to WHO guidelines. So that's our next step, but we're currently constrained as we've run out of funds. So just to wrap up, as I realize I'm slightly over time, access to vital healthcare information in the mother tongue is a right, and in endangered African languages, this is exceptionally rare. Our rapid response team put into action under the COVID-19 pandemic context that proves that such outputs are possible, but we did have an injection of funds that we otherwise usually don't have access to. However, this project is expensive, it's highly collaborative and really intensive. Many of the volunteers and people who are working on this, I would say, suffered from what I would call COVID fatigue, where they were just exhausted on the topic, and it was really emotionally very, very taxing to roll this out. And therefore, in order to continue providing content in endangered languages in Southern Africa in a sustainable way, because the rate in which we did it is just, it's not sustainable for us even, is a formalized and securely funded body needs to be established so that we can continue to support endangered languages in Southern Africa. And we are. Thank you so much.
Thank you for this amazing talk, and also I think I'm speaking for everyone to say thank you for the amazing work you've done for all these communities. I cannot imagine how you managed so much, having done a tiny proportion of this ourselves, or some similar work ourselves. I just cannot imagine how you managed all this amazing work. Are there any questions from the audience? There's lots of encouraging words.
I've just minimized. I'm getting to read the text.
Everyone is expressing their support, and everyone, I think, is just amazed at how much you accomplished.
Thank you very much. I think we felt like we were going to have a nervous breakdown by the end, but we just saw how really we could rally together if we really needed to. But we also learned a lot of really important lessons about orthography and collaboration, and that there's so many components to language documentation and preservation, and funding and infrastructure is very much part of that. And we don't want to, discuss it in a very overly romanticized context that doesn't take into consideration the very real logistics our costs for fuel, for example, just to access the remote villages far outweighed the cost it was to actually produce the materials themselves. So when you're putting together a budget, it's quite difficult to substantiate why you're spending so much money on fuel, yet so little on the language resource itself. And it's purely because we're trying to actually get the resources there.
Thank you.
I see there's a question from Sarah.
Yeah. Sarah, would you like to ask your question, please?
Oh, hi. Sorry. Yes, I wanted to ask, can I ask which approach, when you were looking at these materials, was most successful in sort of disseminating the message or putting the message across? Was it the demonstrations you mentioned, the written media, the video files? What was more successful in helping put across your message?
I think there were so many different modes of communication, but I think that the ones where there was in-person demonstration, as well as the audio at least. So either the person who's doing the demonstration is speaking, or they're using the audio visual. So the more forms of communication, the better. Whereas only the literacy, or so only the posters, or only the booklets, I would say would be the least, because there's very one-sided. There's not the engagement. As soon as there's engagement, it's the same with teaching. As soon as there's engagement, there's much more meaningful communication. So yeah, I think the demonstrations with the videos and the posters was the most successful, but then you have access to all three mediums.
Yes, that makes sense. Thank you so much for answering the question, and thank you for a brilliant presentation.
Awesome. Thanks, Sarah.
Are there any other questions? I just wanted to ask a quick question, sort of in terms of the terminology that you needed to develop. We were mentioning that earlier, that we had an issue with that with Yiddish, and sometimes speakers really just opted for the English term, and we almost sort of insisted on at least creating sort of a term in the language itself. So could you speak to that issue a little bit?
Yeah, so like you mentioned earlier, terms to do with things like social distancing, very strange. Also, in a lot of these particular cultures, that's almost socially taboo to treat a person in this way. And so how do we express this in a way that's respectful, and to recognize a person's health, but when a community where physical touch and physical affirmation through physical touch, especially between mothers and children, and between the generations, even if it's grandmother to grandchildren and so on, these were difficult and challenging things. We thought of, in some instances, it was code mixing, like you say, with using an English term. So we would go for whatever facilitated communication of the concept best. In other ways, they wanted us to rather explain the term. So we wouldn't come up with a new term, because that would be equally as confusing, because there's no agreement on the new term and who creates it. So it's rather that we ask community members, how do we express this best? And we would then use their feedback. It was definitely a bottom-up, not top-down process at all.
Amazing. Thank you very much.